Hello, everyone. I will start in just a few minutes. I'm still waiting for a few more people. We'll just wait a few more minutes for a few late stragglers to come in. Leslie, do you want to turn on your camera so it's not just me looking pretty on camera?
I can't. It says that you have taken my camera away from me.
Oh.
Oh, no, there I am. I tried earlier, but here I am.
How you doing?
I'm good. How are you?
Good. We have 18, 20 people who joined us so far, which is great. Plus the 4 panelists. Yeah, we're just waiting for a few more people. I'm not going to unmute you, but I see some people I know. Gustavo, great to have you join us. Lorianne, always great to see you're joining us. Purnima, great to see you. Stephanie. All right, I'll just get started then. So thank you for joining us for this webinar. It's a pleasure to have all of you join us. We'll be covering today the results of our poll 5, which was the mental health poll we ran from February 1st to February 8th. So we feel this data is less than a month old, which is pretty pertinent. And if you have any questions, please raise your hand. I've actually added Sarah, and I'll add Brittany as well as a co-host. So if they can, I'm hoping they can sort of keep any questions. If you have any questions, you can also add it to the chat, and we'll address it as we can. Anything you wanted to add before we get started, Leslie?
Nope. I think we're good to start.
Hello, Nazim. It's great to see you too. All right, I will pull up the actual report. Okay. So this is the poll 5 report, which I was just showing someone a minute ago. So it's on the late slides. My apologies. I'll take it back to the beginning. Again, this particular poll was 3,000 Canadians. We had a 2,500 in our national sample, and thanks to our partners in Saskatchewan, we were able to add an additional subsample from Saskatchewan of 500 additional participants, which has been turned over to the Saskatchewan Health Research Foundation, and they understand they're distributing as it goes. So we did find, in terms of the major findings I want to cover, we did find the highest rate of anxiety to date, with 25% of Canadians indicating they are an 8 to 10 on the self-rated scale that we provide, and 17% of Canadians indicated that they are an 8 to 10 on our depression scale. The more troubling number for me is the depression number. As anyone who's been following this since the beginning, the depression number moved from 10% at the height of the first wave when we captured the data in April 2020 to 17% now, which is quite a substantive increase in the number of Canadians reporting depression. We did also add an index measure on this one for the first time ever, where we looked at Canadians who were showing 4 indicators of negative mental health, including being 8 to 10 on our scale, Canadians on either the anxiety or depression scale, who indicated moderate to severe when they were provided the Kessler psychological distress scale in terms of the number of points they scored. They also were in the lower quadrants for are you managing stress, and they were in the lower quadrants for do you feel resilient. So when we pulled that number together, it came out at 6% of the population. It's not in the public report, but I can share that we've been doing a deeper dive analysis into that. I can show it at the end of this, where we recognize that 6% sample is 60% female, 37% male, and it is significantly skewed towards younger Canadians, with 18 to 24 representing about 21% of that 6% index, and then further 25 to 34-year-olds representing about 22% of that sample. So all in, that's about 43% of those people who have all four indicators are showing that they are they're young. They're predominantly some common factors among them. They're predominantly showing negative influence as a result of economic indicators, most notably concerned about their job situation changing. That is the most common element we find among them. But we don't find a lot of commonalities or specific points as it relates to visible minority status, education level, or income levels. Anything you want to add to that, Leslie?
No, I think that was covering it. They really do cover a lot of different people. Like, they are younger and female, but when we looked at the other indicators, like, it's not income, it's not education. They really cover a lot of people with that.
Great. So again, we found once again that the activities that people were doing, it was pretty consistent with the previous things we found in terms of negative for social media, not particularly good for physical exercise. But we did find that being outside just continues to be a really positive thing people are saying for their mental health. We also looked at some of the negative indicators. Again, the economic indicators are coming in as quite negative. Although we have seen a steady increase in the negative mental health associated with social isolation, which is something that we're keeping an eye on. And again, same as many reports we see on this, we have seen that younger Canadians are indicating the highest degree of negative mental health, not just from our self-rated scales, but when we actually look at the Kessler Psychological Distress Scale for symptoms, we do see that they are scoring even more negatively on that. So it's not simply a matter, in our opinion, of them over-reporting mental health issues or less of a stigma, but also they're reporting more of the symptoms associated with mental health as well. And that's a common question I get. I'm going to pause there on the summary of major findings and just ask if there's any questions. You can raise your hand or you can put it in the chat. And before I move on to some of the more specifics, I'll just pause for a moment to see if there's any interest in a specific question. Purnima, I see you raised your hand. Let me can someone, I don't know if someone has access. Perfect.
Can you hear me, Michael?
I can. It's always good to hear your voice.
Great to see you. Great to hear about this really, really important work. Thanks so much for hosting this session. Just a quick question about the respondents. You had talked about how there was quite a bit of consistency, I guess, over time in the composition of folks. Did you track I know there's like predominantly female and predominantly younger, but did you track also things like socioeconomic status and race, ethnicity?
So in order to get a big enough sample, we just ask visible minority status,
Okay.
as well as immigration status and income and education levels. So while we do see that there are some things in the self-rated scale, when we look at the composite index of all of the negative mental health factors, it actually removed a lot of the socioeconomic factors as variables that were showing differences.
Okay, great. That's helpful. I guess, I'm just thinking about the sort of profile of individual that tends to fill out these kinds of surveys, and just wondering whether there was a huge variability across the respondents or whether it was pretty homogeneous.
Right. So just in terms of our sample and our sampling methodology, which you touched upon there, we do use an online system, and it is the Leger Opinion. Is it Leger Opinion Panel? Is that what it's called, Leslie, or survey?
Yeah. I think
like
that's it.
And it does have a reasonably high response rate, but we do realize that we have some biases in terms of individuals who are able to access a computer, but it's not a self-selection. So it's not like we're putting out something to say like, fill out our survey. So we do try and deal with some of the biases in terms of a self-selection in our methodology as well. So we do take great pains for that, as well as social desirability biases as well, when we're looking at a lot of this work. And again, you know, we do see some of the socioeconomic factors when we look at one or two of the factors, but when we move them all together into looking at all of the factors and we build out a group of just with all those factors, it does erase a lot of those considerations.
That's great. Thanks so much. Thanks. That's helpful.
No problem. I see a lot of other hands raised. Ash, is it Akshay?
Michael, yes, Akshay, that's close enough. It's good to see you again after the COVID network presentation. I was just curious, well, two separate questions. One was, among these results, was there a finding that you thought was very surprising? And second, I was wondering within this age group of 18 to 34, if you have also been looking at aspects like burnout and if they have been experiencing more burnout or things like that.
So two questions. I'll take the first one. Honestly, my opinion on this has changed dramatically through doing this process. I used to come in with a lot of preconceived notions of what I was expecting to find, and the data has regularly proved me wrong. And so as a result, I try to come in with as much as a flat expectations as possible, which kind of dulls any surprises that I get. I think the one that really caught me by surprise, and I'll get there in a minute, was a new metric we added, which we're interested in digging deeper into going forward, which is the frequency of symptoms that people are experiencing of anxiety. There'll be a slide we'll get there where it's like 49% of Canadians experience either daily or every second day. I think it's something like that. We'll get there in a minute, but the frequency of feeling anxious, which I was surprised by the high number there. I was also surprised, although we've been seeing a creeping up of depression as something that was also rather surprising for me. Leslie, you've been working on this since the beginning as well. Do you want to take a run at that?
Yeah, I think my thought when you first asked the question was the depression as well. And we're now into a year of this, and sort of thinking, at some point it would level off, but it's not. Like it really isn't leveling off. People aren't getting used to the new normal, or they're not accepting the new normal. It is still, everything is still continuing to rise. And I think that was, I expected that to sort of level off at some point, and that's not something that I've seen, which is surprising to me that it still is such a big issue.
And to the second question, you'll see that we do capture a lot of those sorts of factors in the Kessler Psychological Distress Scale, but I don't think burnout is specifically one we ask. But when we get there, you'll see that there's a number on the Kessler scale that are kind of relatable to that issue. And we're not opposed to asking terms like that. I guess my challenge on things like that sometimes is that burnout isn't a really properly well-defined term, as a lot of these other sort of expressions of feelings are as well too. So I always struggle with are people expressing that the way, or is that just, they don't quite understand the terminology around it. But I don't, we'll get to the Kessler scale and you'll see some things we do ask. But I take your point. And if you're specifically interested in adding a question like that, fire me an email, because we have an internal working group. And I also work closely with Health Canada and a number of other organizations. And what we'll do is we'll take a look at all the input we receive from something like this, and I'll present them all to the working group. My job is to present it, and then we have an active dialogue, and some things get included and some things don't get included. So by all means, send that over to me.
Thanks, Michael. I'm a doctoral researcher at University of Toronto, so we'll love to find a way to work with you.
Oh, fantastic. And again, I should have said this at the very beginning. As part of our project, we are sharing the raw data. So if anyone, we're just completing a review of a data sharing policy. Once that is completed, there'll be a two or three page data sharing policy to review and a waiver to sign. And then the data will be turned over to, assuming you're sufficiently with ethics and these sorts of things that are on that policy, we'll turn over the raw files to individuals. And I would like to continue communicating with anyone accessing the data so we can find what interesting nuances they're able to pull out of it. Any other questions?
I do see two questions in the chat. One from Nazim and
Oh yeah, I'm pulling up the chat. Do you remember?
one from Robert Gabris.
Nazim, always great. Do you want to just make Nazim to chat? I'm sure he's fine with that. Hello, Nazim. Oh, you're muted, Nazim.
Hello.
Hello, sir.
Okay, can you hear me now, Michael? Okay,
Yes.
perfect. No, so I mean, this is very interesting. I mean, particularly about the young Canadians, and it is actually emerging as a quite consistently, right? I mean, in our data, that subsample of Saskatchewan, I would say we were a bit surprised, although when you think about it, really not that surprised that the younger, cohort or the younger group compared to older, like 65 plus, were experiencing more mental health issues. What about women? Younger women compared to their counterparts, younger men. Are you finding younger women in particular experiencing more of mental health issues? And if so, to what degree, meaning quantitatively compared to the younger men counterparts?
Yeah, so we do find women, I mean, this is consistent in every research study done for COVID, that women, especially younger women, are reporting higher levels of mental distress. When we did the composite index, we found it just was continued to add to that. It was still younger women, even when looking at all the indexes. So the Kessler Psychological Distress Scale, in terms of the symptoms they were experiencing, resilience, and managing stress. What was interesting for us when we started looking into this specific group was that the most common element was sort of a change in working environment. So did they work less hours? Were they working? It was a number of different employment related situations that seemed to be the most common element among those young, that demographic group, which included young women. So again, I think this is something that we should probably aggregate multiple data points together and look at young women as a specific group. I know that when we ran poll 2, we also found that there were more men in the severe category of the Kessler Psychological Distress Scale, but there were a lot of women in that moderate category as well too. So there's a couple different ways we can look at this. Leslie, you've looked at it. Do you want to add anything to that? Sorry, just to introduce, by the way, Nazim is from Saskatchewan. He has been working with the subsample data. He just got another subsample data, and he did some great work and a report on the poll 2 results.
Just we are definitely, it's the younger women that are really struggling. And part of this, we also find that having children in the household is also adding to it as well. And with having the women who are dealing also with younger children, and I saw that just coming out by the younger women parents. The younger women who are parents are having even harder struggle with it, with dealing with everything that they're having to deal with dealing with their children, with keeping their children safe, and all of that as well. It's also adding to their levels of anxiety and depression.
That's so interesting. And just very quickly, I think the more and more, if we can describe the subgroup of younger women with children and perhaps living in urban places versus rural. I don't know whether that is, whether that's an urban-rural difference, but also kind of some regional perhaps difference as well. It was mentioned, I think Purnima mentioned about socioeconomic status and so forth and so on. But if you can, kind of hone in on, sort of to descriptively kind of identify younger women who are experiencing disproportionate mental health burden during this pandemic, and including the unmet needs, then we might be able to do something, in terms of actually addressing their needs and so on. So that's just a quick thought there. Thanks, Michael. Thanks. Don't want to take too much time.
Thanks, Nazim. Always great to hear from you. In the interest of time, I'm going to move forward, and I'll create another natural stop point where if you have questions, we can keep going. So everyone can access and read this at their own leisure. I'm not going to go deeply into these bullets. I know, Leslie, you work very hard on writing them. They're great bullets, but I feel like we'll cover it. Again, this really does some comparison work to earlier polls where we're just seeing constant increases. We're seeing the Kessler Psychological Distress Scale, where the individuals who are self-rating high are still showing 60 to 65% of them are showing the symptoms of moderate to severe mental distress disorders. And we also looked very aggressively at how people are treating that. Moving to actual some of the charts, this was fascinating to me where we looked at I have a diagnosis or I've had a diagnosis in my lifetime. Having 5% of people say that they've got a diagnosis since COVID of an anxiety disorder is a substantive number. As 5% of Canadians indicating that they've had a diagnosis since the onset of COVID, those are very high numbers when you consider that the 19 and the 20% are lifetime numbers. Again, these are the individuals who are indicating that they have they've had a diagnosis. Again, here we're talking about people with children in the home. That would be more women than men as well. And it was the part that always surprised me, and I bring this up with the sort of Canadian nurses, is the high number of people who are frontline healthcare workers who are indicating they've had a diagnosis. Moving on, again, these are relatively static from the last time. There hasn't been a substantive amount of movement here in terms of when they got the diagnosis. As I mentioned, it's a big number in the last year, but also taking prescription medication has been consistently how people are managing it. We do find some breakdowns as well here in terms of whether they have access to benefits, and there are some differences in terms of how they're managing their mental health treatment. And just to be clear on this one on the right-hand side here too, it's not an only single choice. They can select multiple options here. These are the levels of anxiety and depression continuing to move up. And again, the dates are at the bottom here, so you get a sense of when these things sort of ran. This is a very fascinating one where we talked about how the fact that younger Canadians are dramatically overrepresented on that anxiety 8 to 10 scale. What was interesting for me here that I think we didn't really analyze before, and Leslie, maybe you can touch on this, is the people who were living with their parents or had a roommate. There was, I know adults living with their parents are most likely to have high anxiety, even more so than living alone. Anything you want to comment on there, Leslie? That's a new one.
That was surprising to me, but we found that in a number of areas where when we looked at household composition, and I'll be perfectly honest with you, in looking at household composition, I was really looking at people who were living alone and understanding if that was impacting how living alone was going to impact their anxiety, their depression, what they were going through. But what we really found is the adults who are living with someone who is not a spouse. So roommates or parents, that idea. So these were all adult people. They're at least 18 plus. But those are the people who are actually struggling even more so than those people who are living alone. People who have a spouse are more likely to be doing better. Like they're not struggling as much. I'm not saying they're not struggling, but they're not struggling as much. Those numbers are lower. But really, it's the adults who are living with people who are not a spouse that are really having the hard time.
I found that fascinating.
Yes.
Yeah. I see something's in the chat here.
It could be. You're right.
Yeah.
And it could be that the people who are, and I'll look at that. I don't think I really delved into their income on that. But yes, it could be that the people who are living with somebody else who's not a spouse might be also dealing with more financial issues.
It's a good point.
Yes.
Moving on, I wasn't particularly surprised to see Ontario moving up quite substantially as it pertains to the number of people who are indicating high anxiety and depression. We were well into a lockdown in Ontario when this was taken. So that is not surprising to me. And again, I keep having this surprise though about Quebec consistently always being the province with the lowest number of people indicating high anxiety and depression. I would add that we do offer this fully in French, so it's not a language barrier from the best we can tell, but it's something that constantly has come up. They're always the lowest. This is the Kessler Psychological Distress Scale. So in terms of how people are feeling and whether they're experiencing these sorts of symptoms. We run this test on anyone who is 5 or above on either the anxiety or depression self-rated scale. We do, for consistency, only provide the comparable results for 8 people who score 8 to 10. And again, that's always been pretty consistent. It's not moving a whole lot, where the number of people who indicate that they're moderate to severe using the Kessler Psychological Distress Scale, or that they're experiencing these symptoms are consistently between 60 and 65%. Tired is the most common one as well too. And these, we looked as well in our analysis whether or not these are moving, the actual listing of symptoms and the frequency of them, and they're relatively static between all the polls as well. This was a new question, and this is part of a new partnership we're developing where we're looking at a different way of analyzing this. This is where I think I found one of my great surprises was that recent plus often people, about 50% of the population indicated that they're feeling that way either daily or in the last 1 to 2 days as well. Sorry, they're feeling that not in the last 3 days, but often or above. My apologies, I misspoke. This is a new one. I'll just sit here for a second to cover this off. And again, substantially more with younger Canadians. Interesting, Alberta was high here as well too. Moving on. Again, this is the looking at 2 months ahead. Where do you think your mental health is going to be in 2 months? Again, we found a lot of the same things in terms of roommates, spouses. What's interesting for me though is that anxiety is pretty much spot on. Depression is spot on. We were at 17% of people who thought they were going to be, who are indicating high degrees of depression now, 18% who think they're going to be depressed if 2 more months, if socialization continues. But the number of people who are indicating anxiety goes down, which sort of is this hope that things are going to improve, which is an interesting facet for me, where the people who are indicating depression, that hasn't moved from where it is today. And I think there's an interesting consideration there, which I'm finding hard to quantify into a story. But to me, it looks like there are a number of people feeling anxious who are saying, I'm not going to be anxious in 2 more months. But the number of people who are depressed, who feel that they're going to be depressed in 2 more months, is not moving. Yeah, so data on substance use. The answer to this question is we pulled our data on substance use. We are aware that the commission put out a report, which hasn't really been, I haven't seen it as advertised as much. I know they're starting to work on it in a more substantive way. But 2 weeks ago, they did a report from the same data source we used, which looked aggressively at the connections between substance use and mental health. And our interest was not trying to step on their toes. That is the definitive work on substance use that is published right now from recent data. And if you're really interested in that question, I would advise you to look there. If you can't find it, reach out to me and I will send you the link to that report. Again, by provinces. So this was an interesting one. We wanted to try and ascertain the control for seasonal affective disorder. And so this was an attempt to ask about that question so that in the event that we can extract that information out or understanding the impact of it, our intention is not to run this question consistently. We wanted to ask it in the middle of the winter so that we could understand the effects of it as it pertains to other factors. There's probably some really interesting analysis people could do here. It just wasn't something we really dug into in our analysis in a substantive way. Again, this is looking at how are you managing your mental health and stress. It's pretty consistent where men are indicating that they are feeling like they're handling stress well compared to women. Older people are generally feeling that they're better at managing their stress substantively. And then people with children, there's a minor difference there in terms of no children versus having children. And again, one of the big differences here is they're worried about their finances or not worried about their finances. This is very consistent that we're seeing the economic indicators as being some of the big delineators in this work. Just flying through this as well. These are the charts in terms of, I'm sure if anyone's following this, this is pretty consistent. The number of people who are indicating fear around the virus, fear around the family member catching the virus. The one that's moving is the social isolation number, which is the number of people who are indicating the negative impact of social isolation has moved from 41 to 51%. The rest of them have been pretty consistent, with a notable move that a lot of them moved substantially negative in poll 2, which was August 2020, and then they've been consistent throughout that. For example, even communicating with your families and friends outside your home through Zoom has become relatively neutral in terms of negative and positive mental health impacts. What's fascinating to me there is I just find that those things, and we'll see this later on, some of those things we were doing early on are not as effective as distractions, as coping mechanisms as this pandemic has continued on. Purnima, thanks. Always a pleasure to have you. Okay, moving on. Again, this is where we see a lot of the negative indicators. We do look at the N, or just the people who have indicated they've recently lost their job. That's always been a consistently highly negative experience for those sorts of individuals. And there's not been a tremendous amount of movement here from previous polls. But again, you know, we're seeing that they're pretty static in terms of the economic downturn is a negative impact for just under half of Canadians. And it's been pretty consistently between 44 and 45% since then. This is an interesting one. We're looking at specifically the activities. Sorry, I just saw in the chat there. This presentation is fully available on our website, mhrc.ca. And we'll fire, Julie, we'll make sure you get a copy of it sent by email as well too. Yes, so these are the activities people are doing. And the idea here is to capture what sort of activities people are doing and the effect they're having on their mental health. What's fascinating to me and has been continued to be fascinating for me is that these moved decidedly negative in August 2020, and I thought it was a blip. It wasn't a blip. It has remained relatively negative, where with the exception that I'm noticing that entertainment such as television has been slowly creeping up as a positive mental health experience, moving away from neutral. But yeah, this is the information that we have. The going outside, walking, hiking has consistently remained since we started asking that question, the best activity people can do to support mental health. Leslie, anything you want to add here?
No, I think you covered it, Michael.
I'm really excited about the next thing we ask, which is about resilience. And the reason being that to me, this is a critical indicator of where people's mental health recovery could be. So if people are feeling like they're resilient, that they're able to bounce back from challenges, that's a really good sign for people in terms of recovery. The good news is the number has remained relatively static between 60 and 65%. And on this poll, it was 63%, the number of Canadians who are indicating that they feel like they'll bounce back from it. And again, you see some of the age factor as well here. We do, as a control, look at whether people are monitoring the guidelines. There was an interesting tidbit from previous poll here where we did find people who were less adherent to the guidelines were actually showing more signs and more indications of depression, which I've consistently said, I do not think that not following guidelines is causing depression. I think it's the other way around, where there's some sort of conflating factor here where people are depressed and they're not following guidelines because they can't cope with following guidelines or something. I don't quite know exactly what that is, but I don't think that not wearing masks is making people depressed. I think it's more likely the other way around. We didn't, the sample was a little smaller here, so we decided not to report on that, but we do find it to be consistent. But we didn't indicate it this time because the sample was a little bit smaller. We looked at the situation in terms of how's your employment changed as one factor. By the way, I pulled a slide out here. You probably noticed I pulled a slide out, Leslie. We do have a question in here about vaccine hesitancy, but it didn't move from the poll before, and there wasn't really anything new to show you. So we pulled it out. But for anyone who is new to this work, you can check the results in poll 4, and they are the same in poll 5, which is there a correlation between vaccine hesitancy and mental health? There are some, they're minor. We continuously found 75 to 78% of Canadians are indicating that they are in some way excited about the vaccine or going to get the vaccine. That's not far off from some of the other polls where I've seen 73 to 75% of Canadians are indicating. It comes down to when you're talking 1 or 2%, you're talking also about terminology and language and how you're describing the vaccine and when you want to get it. So those numbers are pretty consistent, and we haven't found a whole lot as it pertains to mental health when we're looking at that specific factor. This is the question, are you worried about making ends meet? Pretty self-explanatory. This is one that we're really excited to keep. What supports were you accessing before, and what supports are you accessing now? The one that always catches me, well, first off, I do note that online services have moved from 3 to 6%, which is essentially a doubling of the number of Canadians accessing online services, which is a reflection of the fact that we are now doing a lot more online services. So that's positive to see, but it still doesn't account for the massive drop in people who were accessing mental health supports through their family doctor who are now no longer doing so. And the other thing that doesn't account for is the fact that there's a much greater need. There are now more Canadians who need mental health supports, but we're not accessing them. That number has essentially doubled. Anything you want to add there, Leslie?
No, I think that covers it as well, Michael.
Great. We kept this question in terms of what services would people be interested in. A lot of people are interested in activities they can do on their own, as opposed to actually resources that require some sort of a medical intervention or professional. Although when you look at the group of people who are highest need, self-help activities actually moves to the second place after one-to-one counseling. So that's it. That's the presentation. I've committed to be done this by, I think, 11:15. So I'm happy to take questions at the end. No questions so far. Oh, I think the peer and professional referrals have also decreased substantially, leading to a decreased use of service. Yeah, I mean, you could certainly, the problem we have is we don't ask why. We have asked a little bit around those questions in previous polls. There's some open ends that we did where we asked why about these sort of things, but we don't have those questions in there anymore. But it's certainly something to consider. You can also raise your hand if you want to talk. No one wants to hear me talk for 45 minutes, trust me. Hello again.
Hi again. It's much easier for me to talk than keep typing at a furiously fast speed. I was wondering what would be the process for requesting access to sort of the data, and also if there are ways of otherwise contributing to the project, because this is an awesome project and I'm very involved with post-secondary students and their mental health projects here.
And actually, so directly to answer your question, as I indicated, we have we're just furiously working to get a data policy waiver completed, which is pending a legal review. So as soon as that's done, if you're associated with the university, there will be no concerns around the security of the data, privacy issues around that sort of thing. All those things would be covered by a standard ethical review. But we will freely turn it over once that is done. Send me your email, and my colleague Brittany, who's also on this call as well too. Either one of us will be able to turn the data or provide you a password to get into the data file. But we'll continue to share it. And our hope is we'll also do some aggregation of the data. So as we do poll 5, 6, 7, 8, 9, 10, we'll have an aggregate file that you'll be able to pull with a data stamp as well too, so you'll be able to look at a larger data set. The specific thing you said about post-secondary has been something that's been on my mind, where I think that we are collecting student. And while we don't specifically ask, and this is for consistency from our earlier polls, are you a post-secondary college, university, trades, or anything like that? We do know that everyone's over the age of 18 and we can't identify student as a category. So I'm super keen to see if someone would do an analysis on students. And there are conversations that I've been having with some other folks around that. We're super keen to turn the data over and start coordinating some efforts on that front.
I would be interested.
Fantastic. Gabrielle, how about adults expecting a child, since younger Canadians, most women, are the ones experiencing more distress? Yes, this has been a question we were thinking about by taking a look at data of anyone who has children that are particularly young, like 1 year old or 0. So because we do ask the age of the children, is that correct, Leslie?
Yes.
We can also look at data for, you could look at an aggregate number of data to say, like, I want all the parents of children who are below the age of 1 or 2. So we wouldn't be able to get, if they're pregnant, we don't have that question, and it's hard to add a question like that demographically because we don't have it prior. We could look at it. But I would be certainly keen to get someone to do an analysis of women who have children who are
But we don't ask like to enter the age, so we have it in buckets. So I'm not sure that we'll have like children under the age of 1. I don't think we have that as a bucket.
Oh, okay. My apologies. I misunderstood. We could add it.
We can do that moving forward though, because it's not, we can definitely, if that's something that we're interested in moving forward, actually have them enter the age of their children, so we can look at like the very, very young. How we're looking at it now is sort of more like the younger children versus
That's right.
older teenage children.
My apologies for misspeaking. But I think I would be interested in bringing that to the committee to see whether or not we would add that question. But I frankly would be keen on adding it because I think it would be great to know newer, younger children, the youngest children, and correlate that.
Yeah, for sure.
Any other questions? Are these findings, such as the relationship between mental health and age, gender, specific to the pandemic versus previous patterns? You know what? That's a question for someone who might have a better understanding of the data prior to COVID. I have access to those individuals on our working committee. My understanding is that it's consistent, but I would not take my word on that. I would look for someone who had more knowledge about pre-data than me. Anyone else? Gustavo, I see you're there. Do you want to ask anything? Because I know you're keenly looking at working on the data yourself.
Hi, Michael. Can you hear
Hi,
me?
Gustavo. Yes.
Yeah, I've seen that the results are pretty consistent with other surveys that have been conducted on the mental health impact of COVID. For example, the young adults be more affected by the pandemic. Is there anything that in these 5 polls that you think it's pretty different from other surveys that you would like to highlight?
Well, I think I haven't seen a lot of people running the Kessler 10. So I think the fact that we're making efforts to validate in whatever degree is possible using this methodology to understand the specific symptoms people are experiencing. And I think that diving deeper into the symptoms questions would be useful, as well as I don't see a lot on previous diagnosis, because when you're doing this sort of work, you need a pretty good sized sample to break down a subgroup like individuals who have a previous diagnosis. So I think by the nature of the longitudinal work we're doing, the frequency of it and the scale of it, as well as the fact that it's not a self-selected survey, does make this relatively unique. And that would be the approach I would take. I also think, the fact that we're trying to find secondary variables such as employment, not just the standard socioeconomic factors, which are pretty common, from looking at the employment categories, which is something that I haven't seen consistently throughout the whole project. So I think that's a few different things that we're touching on that aren't particularly common. All right, well, I think that's all the questions. So my email, which I keep forgetting to put at the back end of this presentation, is mcooper@mhrc.ca. Again, that's mcooper@mhrc.ca. My colleague, Brittany, who's here as well too, bsaab@mhrc. We'd be happy to get your feedback. We'd be happy to take your questions. And if you have suggestions on where we go from here, again, I would be happy to bring that to our working group and discuss how we can implement those sorts of questions. I will make this webinar available. We have recorded the entirety of it, and I will make it available to all of you. And if you want to circulate to any colleagues who might be interested, by all means. With that, I thank you for your time and appreciate all your attention to this. And we'll hopefully touch base with you again after we complete the next poll, which we're aiming to do sometime between March 12th and March 17th to start it. You know, you'll get data again, theoretically, by the middle of April, the end of April would be the next time we report on this publicly. Perfect. Well, thank you so much for your time, and I appreciate your attendance. Have a good day.